So Ropeginterferon is a new form of interferon, as probably you remember, that has improved pharmacokinetic properties, allowing for just one injection every 2 to 4 weeks. And that has been shown already in a phase 3 trial to be superior to conventional therapy in terms of achieving clinical and molecular response. And what we discussed during the meeting is an update after 6 years of follow-up of patients, either treated with ropeginterferon or with the control arm that was composed in almost 90% of patients of hydroxyurea. And what we found after 6 years is that clearly ropeginterferon was superior to best available therapy to induce complete hematological response that was achieved in almost 55% of patients compared to 35% only in the control arm. But obviously, the main difference is still in terms of molecular response, with 66% of molecular response in the ropeg arm compared to less than 20% in the control arm. Importantly, about 20% of the patients who were treated in the ropeg arm achieved an allele burden of the JAK2 mutation below 1%, compared to less than 2% only in the group of patients treated with hydroxyurea and best available therapy, confirming the ability of ropeg to reduce the mutant allele burden and in some patients to eliminate the mutant clone.